Today we're talking about what is TMS therapy. With me today I have Dr. Kevin Murphy. Doctor, can you tell us a little bit about who you are?
Thanks, Kyle. I'm a board-certified radiation oncologist and specializing in pediatric and adult brain tumors. And recently, in the last 10 years, have developed a approach to personalizing TMS therapy.
So, doctor, what is TMS?
So TMS therapy is transcranial magnetic stimulation. It's a process of giving a very small magnetic field through the skull to the cortex of the brain and allowing the brain to fire it at different frequencies. The process is called neuromodulation. And the goal is to find ways to synchronize the brain. In our view, the personalized approach to this process that we call PRTMS allows us to deliver a very unique and uniform dose to various brain regions and having, we think, a better effect than standard TMS.
So you said PRTMS. What is that?
So personalization is picking designer frequencies that we determine by an electroencephalogram. So we first do a spectral analysis of the brainwave function at 19 different locations, and then we can pick designer frequencies that we think are in resonance to the brainwave pattern. And we're amplifying then what the patient's making well, a positive signal. So we're trying to find that sort of sweet spot where a patient goes when they're in the zone, when they get that calm alpha state, and we copy it. And we magnify that signal and take the noise out.
And that's what makes it personalized, repetitive, transcranial magnetic stimulation?
It is. It's daily. It's personalized. Every 5 days, we change the actual protocol to adjust to the patient's response. So in all of medicine, you give therapies. Ideally, you change your approach if the patient's response to that therapy changes. So in PRTMS, there's a weekly update on the protocol, and that allows us to fine-tune the delivery and the protocol regimen.
And that's going to be the biggest difference between TMS and PRTMS, is my understanding at least, is TMS is you're doing the same thing for the entire amount of sessions you're getting, but it sounds like PRTMS you're slowly building and getting higher and higher results.
Well, I would say, yeah, standard TMS treats one location with one frequency.
Okay.
And we treat 5 locations with multiple different frequencies, depending on the location and what the EEG looks like. So it's really customized to the patient. Each person's brainwave pattern's unique, and we have to treat that patient with their brain pattern in mind. And so PRTMS allows a weekly evaluation of the brain pattern and then a weekly adjustment of the protocol to maximize the effect. The effect we're trying to make is a synchronized brain pattern.
So no patient is going to get the exact same treatment.
True. They're going to have likely the same regions treated, the same amount of time, 20, 30 minutes each day. But the frequency, the length of the dose we give, the train length, et cetera, those will all change based upon the patient's response.
I want to thank Dr. Kevin Murphy for joining us today. It's been a wonderful time. If you guys have any questions, leave them in the comment section below. Help us take TMS to the world. And as always, please make it a great day.